Moving on to our sixth image here. And actually, as you all are putting the major diagnosis or the major finding here in the chat, I'll just point out that in the lower right-hand corner, you see a beautiful cell, which is not related to the pathology, but you see that dark red staining. That could be an eosinophil, the elusive eosinophil, along with the elusive basophil, some of the most beautiful cells in hematology. But you all are right on the money in terms of identifying the red blood cell as the site of pathology there. It looks all spiky and funky. This is an acanthocyte or a Spur cell. Now, I put the image of this acanthocyte or the Spur cell on top, and I'm contrasting it with a different finding, which is the acanthocyte in the bottom. They look very similar. Let me give you the clue to tell them apart. Notice that the acanthocyte on top is very irregular. The spikes are different shapes, they're different sizes, whereas in the bottom, there is some variability, but the spikes tend to be of similar size. It's a more regular appearing process. I hope you guys can appreciate that. The top just looks a little bit less organized, whereas the bottom, it's a little bit more regular of a shape. Of course, the association here is with liver disease and a rare diagnosis of A-beta lipoproteinemia. The presentation you'll find there, typically in kids, because it's a disease of childhood, a germline disease, and it looks that way because the membranes are messed up, right? The basic science associations here are ApoB48, ApoB100, autosomal recessive, and you treat by giving them vitamin E and restricting long-chain fatty acids. And someone's pointing out in the chat that a lot of these neurological manifestations is because of fat malabsorption. They don't have vitamin E, and that it impedes the ability to properly maintain the neurons. Just to repeat, the top picture is the acanthocyte or the Spur cell, and the bottom picture is the echinocyte, starts with the letter E, also known as the Spur cell. But have no fear, we'll encounter that in the not too distant future again. Thanks for the questions. All right, I'm going to give you all 5 seconds to absorb. There's a lot of text here. Interesting presentation of the A-beta lipoproteinemia. High yield associations, I know it's a blob of letters and numbers, but again, pretty classic presentation for acanthocytes. You'll notice that liver disease comes up a lot. Liver disease came up here in acanthocytes, it came up in target cells. So there is not one red blood cell morphology. It's not a one-to-one association, liver disease and red blood cells. There's a couple of different ways that it can present.